Gabapentin is commonly used in combination with other medications to help prevent and manage seizures. It can also be used to alleviate nerve pain that occurs after having shingles in adults. Gabapentin is categorized as an anticonvulsant or antiepileptic drug. The recommended daily dosage varies depending on the individual's condition, but it is generally taken 3 times a day with or without food. It is important to take gabapentin at the same times each day to maintain a consistent level in the body. If you have any concerns about the best time to take gabapentin, consult with your healthcare provider for personalized advice. Before taking gabapentin, make sure to read the medication guide and patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor. The dosage is based on your medical condition and response to treatment, and for children, the dosage is based on weight. Follow your doctor's dosing instructions exactly, and during the first few days of treatment, your doctor may gradually increase your dose. To minimize side effects, take the very first dose at bedtime. Take this medication regularly to get the most benefit from it. This drug works best when the amount of medicine in your body is kept at a constant level. Take gabapentin at evenly spaced intervals at the same times each day. If you are taking this medication 3 times a day to control seizures, do not let more than 12 hours pass between doses. Do not take this medication more often or increase your dose without consulting your doctor. Your condition will not improve any faster and the risk of serious side effects may increase. Do not stop taking this medication without consulting your doctor, as some conditions may become worse when the drug is suddenly stopped. Your dose may need to be gradually decreased. If you are also taking an antacid, it is best to take gabapentin at least 2 hours after taking the antacid. And different forms of gabapentin are absorbed in the body differently, so do not switch from one form to the other without consulting your doctor. Tell your doctor if your condition does not improve or if it worsens. If you experience drowsiness, dizziness, loss of coordination, tiredness, blurred or double vision, unusual eye movements, or shaking, let your doctor know. This medication has been prescribed because the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, tell your doctor right away if you experience swelling of the hands, ankles, or feet, as this could be a sign of a serious side effect. Additionally, a small number of people who take anticonvulsants may experience depression, suicidal thoughts/attempts, or other mental/mood problems. If you or your family/caregiver notice any unusual/sudden changes in your mood, thoughts, or behavior, including signs of depression or suicidal thoughts/attempts, tell your doctor right away. Get medical help right away if you experience slow or shallow breathing or any symptoms of a serious allergic reaction, such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed above, contact your doctor or pharmacist. Before taking gabapentin, it's important to let your doctor know if you have any allergies to the medication or any of its inactive ingredients. It's also important to discuss your medical history, including any kidney disease, mental health issues, drug or alcohol use, or breathing problems. Gabapentin can cause dizziness, drowsiness, and blurred vision, especially when combined with alcohol or marijuana. It's important to avoid driving or using heavy machinery until you know how the medication affects you. Limiting alcoholic beverages is also recommended. If you're planning to have surgery, make sure to inform your doctor about all the medications and herbal products you're using. Older adults and children may be more sensitive to the side effects of gabapentin, so it's important to monitor for symptoms such as swelling of the hands/ankles/feet, slow/shallow breathing, dizziness, loss of coordination, or changes in mental health and behavior. For pregnant women, gabapentin should only be used if clearly needed, and it's important to discuss the risks and benefits with your doctor. The medication also passes into breast milk, so it's important to consult with your doctor before breastfeeding. Make sure you're aware of any potential drug interactions that could affect how gabapentin works or increase your risk of serious side effects. You should keep a list of all the medications and products you use, including prescription and over-the-counter drugs, as well as herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with gabapentin is orlistat. Taking gabapentin with other products that may cause drowsiness or breathing problems, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines, can increase the risk of serious side effects. Be sure to talk to your doctor or pharmacist if you are using any of these products. It's also important to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. If you have any questions, ask your pharmacist about using those products safely. Avoid using gabapentin with other medications that contain gabapentin, including gabapentin and acarbol. Additionally, gabapentin may interfere with certain lab tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are using this drug. If you or someone you know has overdosed on gabapentin and is experiencing serious symptoms such as passing out or trouble breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can call your local poison control center at 1-800-222-1222, while residents of Canada can call a provincial poison control center. Symptoms of overdose may include severe drowsiness, trouble speaking, and weakness. Gabapentin should not be shared with others. It is used to help control certain types of seizures in people who have epilepsy. It is also used to relieve nerve pain caused by herpes virus or shingles infection. In addition, it is used to treat restless leg syndrome, RLS, and certain types of nerve pain. The dosage is based on your medical condition and response to treatment. For the best effect, take this medication at evenly spaced times. It is usually taken with a full glass of water, with or without food. If you happen to miss a dose of gabapentin, take it as soon as you remember. However, if it's close to the time of your next dose, then just skip the missed dose and continue with your regular schedule. It's important not to take a double dose to make up for the missed one. If you are taking gabapentin 3 times a day to control seizures, make sure not to let more than 12 hours pass between doses, as this could lead to an increase in seizures. If this happens, it's crucial to consult your doctor immediately. When it comes to storing gabapentin, it's important to keep it at room temperature and away from light and moisture. Make sure to store it in a place that is not the bathroom, and always keep it out of reach of children and pets. When it comes to disposing of gabapentin, it's important not to flush it down the toilet or pour it into the drain unless instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. If you're unsure about how to do this, consult with your pharmacist or local waste disposal company for guidance. Remember, it's important to handle medications responsibly to ensure the safety of yourself and others. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.